So, good morning, everyone. So, for this video lecture, this will be the last topic on the Carabao production, which is on the health and diseases of it. So, first, let's talk about herd health management. So, how do we manage the um, health or the well-being of the um, animals of our carabaos in a herd. So first, we need to maintain animal health and production at the most efficient level. Then we need to provide full economic benefits to the farmers. So yun yung aim ng herd health management. We maintain an animal health and production at the most efficient level, meaning um, we maintain yung health ng animal in such a way that uh, it is productive. And then it provides full economic benefits to the farmer. Since we're maintaining a productive animal, we're maintaining the health of the animal in order for it to be productive. Then, when it is productive, then um, may economic benefit to the farmer. Kikita yung farmer. So, yun yung goal ng herd health management. And then, you there is the integration of livestock medicine with all aspect of production technologies having the same end in view, which is to um, increase the productivity, maintain the health of the animal. So we integrate any parang health management, mga production management and then health management, we integrate each other para ma-maintain natin yung health ng animal, para ma-maintain natin yung efficient level of productivity ng animal. So, there are two uh, key player or key component of on the success of the um, health management, herd health management, herd ito. So there are two players, two components of it. So first, we have the veterinarian and then the farmer. So the um, veterinarian, she or he will be the one who will parang um, come up with a plan, come up with a health program for the animal. So siya yung parang gagawa ng mga health program, like for example yung vaccination program, yung disinfection, cleaning and disinfection, at lahat na ng mga aspect when it comes to the health of the animal, siya yung gagawa ng program na yun. And then um, yung farmer, siya yung mag-i-implement yung ginawang program ng veterinarian para makapag-produce ng healthy and productive na carabao. So, yun yung kailangan. So, hindi maaari na iisa lang yung gagawa. So, like for example, hindi maaari na yung veterinarian lang yung nandoon sa herd health management program. At hindi rin maaari na yung farmer yung mag-isa lang na gagawa. So, kailangan nung expertise ng veterinarian, kailangan niya nung mga expert na opinions, yung expertise ng veterinarian when it comes to health management. And then, kailangan rin yung farmer kasi siya yung mag implement mismo ng mga um, suggestions, mga programs na ginawa ng veterinarian. So, they go hand in hand itong dalawang to. So, in general, farmers are traditionally willing to pay for emergency veterinary services on sick animals but are reluctant to pay for health services when the results are not immediately obvious. So, sinasabi daw na most of the farmers natin, they are willing to render the services of the veterinarian when it comes to sick animals. Kung may nakita yung farmer na may sakit na animal, then um, willing siya na tumawag ng vet para gamutin yung sick na animal. Pero may tendency kasi na ayaw nilang magbayad or nagdadalawang isip sila na magbayad. Lalong-lalo na if hindi nila kita kaagad na gumaling yung animal. So hindi nila nakita kaagad yung result ng service na ginawa nung veterinarian. So kumbaga, like for example, um, meron siyang sick na karabaw, hindi makatayo. So ngayon, tumawag siya ng veterinarian. Yung vet naman, nag-administer siya ng mga drugs, nag-administer siya ng antibiotic, ng mga vitamins, kung ano-ano man dyan. So, ang tendency kasi hindi agad-agad na gagaling yung animal. So, may reluctant ngayon yung mga farmers to pay for that service since hindi nila nakita nilang tinurukan na ng mga medicines pero hindi nila um, nakita na gumaling kaagad yung animal. So, ganun yung parang problem. So, there is a widespread problem na ngayon in the adoption of yung health services. Especially ito sa mga rural areas. So, yung mga farmers, some farmers dun sa mga rural areas, they do not fully appreciate yung mga sakit kasi hindi nila masyadong tinutuunan ng pansin. Kaya nagsasuffer ngayon yung um, health ng animal at saka yung production ng animal. So, for the requirements of a herd health program, first, uh, the willingness of the farmers to accept good animal husbandry practices. So, kailangan um, willing yung farmer na i-implement yung mga good animal husbandry practices, yung mga management practices that the farmer needs to do in order for the animal uh, to become healthy, mga ganun. So, in implementing kasi yung good animal husbandry practices doon sa farmer, yung pagsasuggest mo ng mga management practices, we need to consider yung um, goals and objective ng farmer, kung ano nga ba yung um, gusto niyang mangyari doon sa animal, kung ito ba ay for milk production, kung ito ba ay for meat production. So we need to consider that. And then another one is that we need to consider yung resources ng farmer. So baka naman yung sinuggest mo na animal husbandry practices, hindi kaya ng farmer na i-implement since wala siyang resources. So kailangan nating consider rin yung resources ng farmer. Kasi this will determine the success of the program. So yung gagawin mo in order for the farmer to be willing to adopt yung herd health program mo is to um, convince him of the benefits nung program na yon. Yung sasabihin mo na pag sinunod mo ito, hindi magkakasakit yung animal mo, hindi siya susceptible to diseases, um, mas productive, mas efficient yung productivity ng animal mo, so mga ganun. So, kailangan nating i-convince yung mga farmers natin in order to adopt itong mga herd health program natin. So, when we convince yung farmer, then susunod na yung willingness nila na to accept yung mga management practices, yung mga good animal husbandry practices natin. So, yung health program natin, dapat nakatuon yung focus niya in solving yung mga prevalent diseases doon sa area ng farmer. So, kailangan na nakatuon yung pansin na doon, and then dapat meron siyang immediate, yung herd health program natin, meron siyang reliable solution. So, Kapag ganun, mayroong focus doon sa disease na nakikita ng farmer and then may present ka na solution, uh, mataas yung percentage that the farmer is willing to cooperate, the farmer is willing to participate, the farmer is willing to implement yung sinasuggest nating herd health program. Then another one is the presence of an enthusiastic and competent veterinarian. So, di ba sinasabi ko kanina na there are two key players on the herd health program, yung farmer, and then yung isa is yung veterinarian. Now, yung veterinarian dapat enthusiastic siya. So, when we say enthusiastic, parang may passion siya doon sa ginagawa niya. So, dapat may parang interest siya ah, na talagang ah, mag-offer ng solution doon sa mga diseases. Dapat enthusiastic siya doon sa paggagamot doon sa mga um, prevalent diseases. And then when we say competent, alam niya yung ginagawa niya. So, competent in a sense that first, dapat may license siya to as a veterinarian. So that's one of the parang factor that we need to consider para sabihin natin competent yung veterinarian, dapat may license siya kasi pag may license siya, then most probably he or she knows what she is doing. So alam niya yung mga diseases na based on their symptoms, alam niya yung gagawin niya, alam niya yung mga gamot na isasuggest na i-administer niya doon sa sick animal. So, kailangan yon yung presence ng enthusiastic and competent veterinarian. And then another one, practice of record keeping and identification. So, kailangan pa rin talaga na meron kang form ng identification for your herd. Lalong-lalo na if it is more than 20, more than 10 na carabao in your herd, kailangan may form ka ng identification like ear tagging, pwedeng ear tagging, or pwede yung ear notching. So these are like the most common na um, identification na ini-implement or ginagawa doon sa mga herd natin. So, yung ear tagging, meron siyang number. So, this will help in record keeping. So, like for example, yung Carabao number 413, mga ganun. So, yung Carabao 413, nagkasakit ng ganito. And then, nakikita mo na yung Carabao na 413, palagi siyang parang nakadikit doon sa Carabao na number 420, mga ganun. So, meaning, if meron silang identification, nakikita mo kung sino yung parang mataas yung percentage na mahawaan nung sakit nung Carabao number 413, which is yung Carabao number 420 kasi sila yung palaging magkadikit, sila yung palaging magkasama. So, yun, it helps doon sa pag-identify natin ng mga may sakit. So, it is a major factor ito affecting yung development and success ng herd. Itong practice natin ng record keeping and identification. It is only through a good recording system that one could see yung effective performance ng animal. The one could see kung maganda nga ba yung productivity ng animal, and you could see pag may maganda yung identification mo, kung may identification sila, makikita mo kagad kung sino yung may sakit and then pwede mo na siyang i-isolate. So, yun yung requirement for a herd health program. So, aside from those requirement, meron rin itong mga additional requirement that you need to include, lalong-lalo na sa farm mo. So, first is adequate physical facilities for handling animals. So, kailangan na meron kang yung mga facilities that will enable you to handle yung animal efficiently. So, dito pumapasok yung mga tinatawag nilang chute or mga squeezer na mga facility. So, dito, basically itong chute or squeezer na mga facility na ito, dito pumapasok ngayon yung mga animals, yung mga may mga sakit na animals para for routine inspection. So, yung chute or squeezer parang siyang box parang box na may opening doon sa isang side kung saan doon papasok yung animal. Now, pag nakapasok na yung animal, pwede mo nang i-close yung parang box na yon, yung chute na yon na tinatawag. So, pag na-i-close mo na yon, then you can be able to perform physical examination on the animal since hindi na siya makakagalaw. Kasi medyo maliit yun parang sakto lang doon sa size, doon sa body size nung Carabao. So, uh, meaning hindi na siya makakagalaw. So, um, makakapag-perform ka na ng routine inspection. Ma-inspect mo na yung physical appearance ng animal without having the trouble to parang yung uh, gumalaw-galaw yung animal. Kasi pag masyadong magalaw yung animal, hindi mo siya ma-i-inspect ng maayos kasi nga masyadong magalaw. And at the same time, this will prevent any injuries both doon sa animal at saka doon sa nag-i-inspect kasi nga hindi na makakagalaw yung animal. So, kailangan mayroon ka nitong mga adequate physical facilities na ito para um, um, ma-implement mo talaga yung mga management practices doon sa herd health program. Another one is that you need to have sufficient pens. So, kailangan may mga sufficient na kulungan ka for your carabao, especially if there is merong carabao na may sakit. So, yung gagawin mo is pwede mo siyang i-isolate. So, hindi mo to magagawa kung wala kang sufficient pen. Yung pen mo lang kumbaga is for yung herd lang talaga. So, iisang pen lang talaga. So, pag may nagkasakit din, saan mo ilalagay? So, kailangan may sufficient pen ka for isolation. So, yun yung um, gagawin mo. Hindi lang for isolation. Dapat pag may sufficient pens ka rin for treatment and for observation. So, lalong-lalo na if may sakit yung animal, then i-isolate mo siya, then doon mo siya gagamutin, doon mo siya i-observe kung gagaling ba or magwo-worsen. So, kailangan may adequate physical facilities ka pa rin. And then, there should be a veterinary diagnostic laboratory, especially if uh, especially if hindi talaga sure yung disease na yon. So, yung gagawin, kukuha ng blood sample, mga saliva, mga ganun. Basta any sample that the veterinarian needs, then doon sa laboratory, doon niya i-kakandak yung mga test in order to confirm if, in order to confirm yung diseases. So, through laboratory lang talaga, 100% 100% sure mo na yun talaga yung disease. So, through laboratory testing. Then, another one is a field record book or yung notebook for recording visits and observation. So, dito malalaman mo kung sino yung pumasok dun sa farm mo, sino yung mga lumabas dun sa farm mo, ano yung mga animals na bagong pasok dun sa farm mo, ano yung mga animals um, na market na lumabas na doon sa farm mo. So, kailangan meron ka nitong record book kung saan nandun lahat ng activity doon sa farm mo. Kung sino yung mga pumasok. So, dito, malalaman mo if may nagkasakit, then you can trace it back doon sa record book mo kung sino yung mga pumasok within that certain week. And then, i-confirm mo baka naman yung mga pumasok na mga tao, mga pumasok na vehicle, may dalang sakit pala. So, you could be able to confirm it if you have record of all of this, recording of the visits, at saka yung mga observations mo. So, kailangan meron ka nitong record book or itong notebook na ito. So, um, in a herd health management, yung gagawin dapat, we need to prevent it. So, second option na lang talaga yung pag-treat doon sa disease. So, yung goal ng herd health management is to prevent yung occurrence ng disease doon sa farm. So, yun yung ultimate goal niya. Hindi niya ayaw natin na gagamutin pa natin, i-treat pa natin yung um, may sakit na animal kasi dagdag gastos lang to. So kailangan i-prevent na natin as habang maaga pa dapat may preventive measures na tayo. So first preventive measure is start with healthy stock. So basically pag nag-start ka ng isang Carabao herd, Carabao production. Yung pagbibilhan mo, tignan mo kung maganda yung mga stocks niya. Tignan mo yung physical appearance, kung um, maganda ba yung body disposition, maganda ba yung physical appearance niya, wala ka bang nakikitang um, deformities, wala ka bang nakikitang mga abnormalities. So, tignan mo ng maayos. So, it helps if you have knowledge on the animal itself doon sa Carabao mismo. Kung ano nga ba yung healthy, ano nga ba yung sick na Carabao. So titignan mo, then doon ka pipili doon sa mga healthy. So pag nakapili ka na ng mga healthy stock mo, yung gagawin is you isolate them for a minimum of 30 days after purchase. So yun, ganun ka a month, 1 month mo siya na i-isolate. Hindi, pag nakabili ka na ng stock mo ng Carabao, hindi agad-agad na ipapasok mo doon sa herd, doon sa existing herd mo. So, kailangan na naka-isolate siya within 1 month. So, bakit natin ginagawa ito? In order to determine if it is disease-free nga ba talaga. Kasi within that 30 days, kung may sakit man yung nabili mong stock, lalabas at lalabas yun. Makikita natin yung symptoms within that 30 days. Kung wala man sakit yun, then wala kang makikitang symptoms. It will remain healthy within that 30 days. So, pag healthy, nakita mong healthy siya within that 30 days, then doon mo lang siya i-introduce doon sa existing herd mo. Pero pag nakita mong may sakit within that 30 days, then doon ka magtitreat ng animal, ng mga medicine mo. Ititreat mo yung animal mo, gagamutin mo, and then, pag nakita mong magaling na siya, doon mo lang siya i-introduce doon sa herd mo. So, yun. So, another one is we need to practice parasite and disease control na tinatawag. So, some of the diseases sa Carabao and other ruminants, yung parang cause niya is dun sa parasite and disease control. And uh, there are two types ng parasites. Pwede yung sa external parasites and then yung sa internal parasite. So yung gagawin, you need to practice parasite and disease control. So um, mga parasite control such as deworming, if it's for internal parasite. Pwede rin yung delousing na tinatawag. Itong delousing na tinatawag mo, yung target niya is yung mga lice, yung mga lisa na nandoon sa animal, doon sa skin ng animal. So, in practicing itong parasite and disease control, yung pag-administer ng dewormer at saka yung mga delousing na tinatawag, we need to consult yung veterinarian for yung mga drugs, effective drugs and chemicals that we can use, as well as yung dosage niya kasi baka naman um, yung farmer basta na lang na magbibigay ng dewormer doon sa animal um, masyadong marami pala yung binigay, then it may lead to toxicity. Baka ma-overdose pa yung animal, baka ikamatay pa. So we need to consult yung veterinarian doon sa right drug na gagamitin natin, as well as yung dosage, kung ilan nga ba yung amount ng ilalagay natin or ibibigay natin doon sa carabao natin. And then as well as yung frequency of application, kung ilang beses nga ba sa isang araw mo na gagamutin yung animal, ilang beses ba sa isang araw na ibibigay mo itong dewormer sa animal. So yun yung kailangan natin. So kailangan nating i-consult talaga doon sa veterinarian before we administer itong mga dewormers or any other anthelmintic ticks for the parasite. Then another one is we need to provide adequate quality ration. So kailangan maganda yung nutrition ng animal. Kasi if maganda yung nutrition ng animal, most of the diseases that that comes from yung deficiency on mga protein, deficiency on mga vitamins, mawawala kasi nga maganda yung pinapakain natin doon sa animal. So the ration that we provide to the animal, it should meet yung nutrient requirement ng animal. It should meet the nutrient requirement ng carabao natin. So, in order for them to resist yung disease, in order for them to be resistant to infection, and in order for them to be resistant to mga parasites. So, kailangan, we need to provide them with adequate quality ration. Then, we also need to give optimum protection from environmental stress. So, dito rin umuugat, dito rin nanggagaling yung diseases pag masyadong stress ng animal due to weather, um, mas susceptible siya kasi sa attack. Mas susceptible siya doon sa mga bacteria, doon sa mga viruses. Kaya yung nangyayari, if stress yung animal, um, magkakasakit yan. So we need to give optimum protection from the environmental stress. So we need to provide them yung proper housing nila. So when we say proper housing, maganda yung roofing, maganda yung ventilation. So yung roofing dapat walang tumatagos na mga tubig ulan. Yung roofing dapat uh, na protect yung carabao against direct sunlight. So mga ganun. And then, lastly, we need to maintain good sanitation practices, especially when animals are individually confined or doon sa mga nasa quartered na pens, yung mga nandun sa iisang pen lang. So, kailangan, dapat i-dispose natin yung mga tae nila, yung mga waste nila properly. Kasi itong mga tae nila, itong waste nila dito na pwedeng pamahayan ng mga bacteria, ng mga pests, mga insect. So, that can be a vector of diseases. So, kailangan we have good sanitation practices. So, these are the things that we need to consider. These are the things that we need to do in order to prevent yung diseases, in order to prevent the occurrence, the prevalence of diseases. So we have here again yung mga other preventive measures. So first, another one is graze animals in pastures that are relatively safe from infective stages of internal parasite. So ito yung parang kailangan one of the things that we need to do. So when we say graze animal in pastures that are relatively safe from infective stages of internal parasite, one classic example is yung liver fluke na tinatawag. So itong liver fluke kasi na to, yung infective stage niya, pwede yung, or yung pwede kasi na pumunta doon sa inside the body of the animal is yung larval stage ng fluke. Now, itong larval stage ng fluke na ito, naninirahan sila doon sa mga snail, doon sa mga nakikita natin na snail doon sa grasses. So, doon sila naninirahan. Now, if yung animal nakuha itong snail na to, na kinain itong snail na to, kasi yung mga snail, most probably mga maliliit lang yan. So, pag nag-graze yung animal, pwede niyang makain itong mga snail na to. And then, at the same time, pwede niyang makain yung liver fluke, yung larval stage ng liver fluke na nandoon sa snail. So, now, yung larval liver fluke na yun, um, pwedeng manirahan na doon sa loob, doon sa body ng animal, doon sa liver ng carabao. So, doon siya maninirahan hanggang sa adult stage. Uh, this will be considered as a parasite na. So, ida-damage niya yung mga liver and other internal organs ng animal. So, this may lead pag talagang grabe na yung infection ng parasite, then this may lead to death. So, yung kailangan natin is to practice yung pasture rotation na tinatawag. Kasi, yung life cycle ng liver fluke, uh, yung egg nandoon sa tae ng animal. Now, if palaging yung pasture area is doon palagi yung pinagre-grazan, pinagkakainan ng carabao, mataas yung tsansa na makukuha niya ulit yung liver fluke kasi doon siya tumatae, doon nag-hatch yung liver fluke, doon rin ah, lumalaki yung liver fluke, then doon rin na kinakain or nakakain ng carabao yung liver fluke. So, yung life cycle nung liver fluke, anong tawag nito? Nagka-continuous kasi iisa lang yung pasture area mo, iisa lang yung pinagkakainan nung pinagre-grazan nung carabao. So, kailangan i-practice natin yung pasture rotation. Kasi pag tumae yung carabao sa pasture na ito, then within 4 to 7 days, I think, mag-hatch yung liver fluke. So, kung within that day, anong tawag nito? We practice pasture rotation, then um, there is lower chances for the carabao to ingest na ngayon yung liver fluke kasi nga nilipat muna siya sa ibang pasture area wherein um, walang liver fluke. So yun. So kailangan we practice pasture rotation. And then we need to deworm regularly. Especially if alam mo na may mga prevalence ng internal parasite, mga gastroenteric na parasite, yung mga parasites na naninirahan sa loob ng carabao. Then we need to deworm regularly. And then the louse with proper concentration and frequency. So kailangan rin kasi lice are also parasites. Now these parasites kasi um, yung pinagkukunan nila ng energy nila is within that carabao, within that animal. So, this may lead to decreased productivity. So, kailangan pa rin na tanggalin natin itong mga lice na to through the lousing. And then, we need to consider when we try to delouse, kailangan proper concentration and frequency para matanggal talaga yung mga lice. Then, another one is we need to call out unproductive breeding stock. So um, yung mga masyadong matatanda na animals, kailangan natin na wag nang parang dapat i-call out na natin, dapat i-market na natin, dapat i-slaughter na natin kasi unproductive na sila eh. Um, hindi na sila parang, kasi malulugi ka eh. Hindi na sila productive. So, meaning, yung binibigay nila, hindi na sapat doon sa ginagastos mo sa kanila. So, kailangan na i-call out na natin. Then, we need to conduct regular checks for the presence of parasitic diseases. So, kailangan yan, ma-observe mo naman if there is a um, presence ng parasitic diseases. And kung nagdududa ka pa rin, then you can consult a veterinarian for diagnostic examination. So, pwede kang pwede mong i-inform yung vet mo na pumunta doon and then titignan niya siya titignan niya kung may prevalent nga ba ng parasite doon sa inyo. Then, you need to segregate animals during disease outbreak. So, yung mga animals mo that are sick, that are visibly sick, yung nakikita mo na may sakit talaga, then you need to segregate them. You need to isolate them para hindi sila makahawa. Then you immediately contact yung veterinarian mo for assistance. Then, another one is you immunize regularly against diseases. So, yung immunize na tinatawag, pwede yung mga vaccination program natin. So, if they are properly vaccinated, then they have immunity against yung mga diseases that are caused by virus. So, kailangan we regularly vaccinate them. So, here we have a parang specific na mga health program practices, management practices that we need to employ based on the stages of the Carabao. So first, before breeding. So if there is a group of animal from which breeders are to be selected, pick out those which are potentially good ones based on physical characteristics, temperament, and previous reproductive performance, and pedigree if known. So kailangan na sa before breeding pa lang, so doon sa pagpipili pa lang ng mga breeders mo, kailangan na i-implement mo na tong health program. So, kailangan um, mag-select ka ng animals that are healthy and that are sa tingin mo may potential to become productive. So, yung pagpipili, nakabase yan sa physical characteristic. Kailangan na maganda yung body disposition ng Carabao. Kailangan na maganda yung yung physical appearance, walang deformities. Then, kailangan rin na may maganda yung temperament, hindi masyadong aggressive, mga ganun. And then, kailangan mo rin makita through records yung reproductive performance ng pipiliin mo na breeder. So, kailangan maganda yung reproductive performance. If it is a bull, dapat maganda yung ejaculation, yung amount ng ejaculation, dapat maganda yung sperm motility, maganda yung sperm viability. Pag naman babae yung pipiliin mong breeder, dapat maganda yung walang history ng abortion, walang history na nagkasakit, and then walang history na masyadong mataas yung mortality ng mga anak niya. So, kailangan mong tignan yung mga reproductive performance. And then, yung pedigree na rin. Kasi, uh, dito mo makikita yung parang ancestor nung pipili mong breeder, kung magaganda nga ba, kung purebred nga ba, mga ganun. So, ito yung mga kailangan mong gawin before breeding, before ka mag-breed, before ka mag-implement ng mga breeding program mo. So, ito yung mga kailangan gawin para ma-ensure natin na yung animal mo is healthy. Then, pag nakapili ka na ng mga breeders mo, you need to conduct a blood testing on the animal para matignan natin if there are diseases. So, yung mga diseases such as yung mga brucellosis, leptospirosis, mga blood parasites. So, kailangan i-conduct natin yung blood testing para safe talaga na yung i-introduce nating breeder doon sa herd, it is free from diseases. So, you can consult yung Bureau of Animal Industry of the Department of Agriculture, yung mga regional animal disease diagnostic laboratories natin. Pwede rin yung Provincial Veterinary Office or any other veterinary authority for guidance kung ano ba nga ba yung mga protocols na kailangan gawin when it comes to blood testing. So, you can consult these offices para sila yung magkakandak, pwede sila yung magga-guide sa'yo kung ano yung tamang gawin. So, basta, by the end of the day, dapat na test mo muna ng blood. May blood testing muna na naganap para you make sure na disease-free yung nabili mo or nakita mong stock. So, um, before you introduce rin doon sa herd mo, yung breeder mo, you need to deworm the animal with broad-spectrum anthelmintics. So, when we say broad-spectrum anthelmintics, itong broad-spectrum kasi, as the name implies, malawak yung pwedeng i-apektaran ng mga parasites. Hindi lang specific na parasite yung i-attack or gagamutin. So, it is a broad spectrum anthelmintic. So, maraming mga parasites yung pwede niyang gamutin, maraming parasites yung pwedeng maapektaran when you administer itong broad spectrum anthelmintic na tinatawag. So, some example are itong mga to. So, you have yung thiabendazole, parbendazole, tetramizole, pyrantel. Ito yung mga pwedeng broad spectrum anthelmintic mo. Then, if there is widespread infestation ng liver fluke or meron kang na-confirm na liver fluke within your head, you can treat yung simultaneously by using yung specific drug or fluticide. So, kung may confirm na liver fluke doon sa herd, doon sa pasture area mo, if may nakita kang liver fluke, then one thing that you need to do is mag-administer ka na ng drug that is specific for liver fluke. Mga drugs that are specific in treating yung liver fluke infestation. So, yun yung gagawin. Then, you can inject also the animal with vitamins A, D, and E to improve their reproductive performance. And then, vaccinate them against disease that is prevalent in the area. So, like foot and mouth disease, pwede hemorrhagic septicemia, blackleg, brucellosis, anthrax. These are all viral diseases. So, pwede mong i-vaccinate sila. So, dapat all vaccination must be regularly scheduled and preferably accomplished before breeding or pregnancy occurs. So, kailangan na naturukan mo na sila ng vaccine para healthy na talaga yung animal, para hindi na talaga magkakasakit yung animal. Dapat naturukan na siya ng vaccine before breeding or pregnancy occurs. So, after breeding naman, syempre, aasahan natin na magiging pregnant. So, sasabihin na lang natin na magiging pregnant yung mga nasa herd mo. So, during pregnancy, we can maintain a high nutrition level of the animal. Dapat i-maintain natin yung nutrient requirement ng carabao that is pregnant. So, we need to provide nutritional supplements such as vitamins and minerals para talagang protektado siya against diseases. So, we can inject yung pregnant animal, pregnant carabao, with vitamins A, D, and E in the second or third trimester of pregnancy. During yung 6 to 7 month na pregnant yung animal, we can inject yung vitamin A, D, and E. Then we can deworm the animal against common intestinal roundworms using wide-spectrum dewormers during the last 2 to 3 weeks of pregnancy. So, yun yung gagawin. And then, we separate the dam in the advanced stage of pregnancy para hindi siya masyadong stress. Kasi, pag nasa herd lang siya, baka mai-stress pa. Baka ma-stress due to crowding, baka makahawa pa ay baka um, makakuha pa ng mga diseases doon sa herd. So, kailangan during yung late stage ng pregnancy, yung alam mong malapit ng mga anak, you can isolate. You separate yung pregnant na Carabao away from the herd para sa ganun, comfortable siya and then stress-free siya. Then, pag alam mong manganganak na, which is called the calving on Carabao, then cut the umbilical cord 2 in the uh, 2 inches from the body and point or dip the remaining stump of in iodine solution or spray with antiseptic solution for a day-old calf. So, ikakat mo daw yung umbilical cord 2 inches from the body and then ididip mo ng iodine solution or pwede kahit anong wound spray para hindi walang mangyayaring infection doon sa calf mo. So, yun yung gagawin sa calving and post-calving. So, you can also ensure that the calf is able to receive yung colostrum within 6 to 12 hours after birth. So, kailangan na sure ka na yung calf, yung bagong panganak na Carabao it was able to suck on the udder of the um, cow, on the Caracao. Kailangan na uh, nakapag suck siya or na, nakainom siya ng colostrum. Since yung colostrum, it is full of nutrients, it is full of proteins, mga vitamins, and antibodies that will help the calf to become healthy, that will help the calf to become resistant dun sa mga diseases. So, kailangan na you make sure that it receive colostrum. So, if the calf is too weak to suckle, assist or train it to nurse on the dam or feed by bottle or pail. Then, store frozen colostrum when necessary for orphan calves. So, kung masyado daw weak, hindi makatayo, hindi makasak ng maayos yung calf, then, doon ka mag-intervene, doon ka papasok kung saan i-assist mo yung i-assist mo yung hindi sow, i-assist mo yung calf to suck properly para maka-receive pa rin siya ng colostrum. Then, you can store yung frozen colostrum mo when necessary for orphan calves. So, kailangan pa rin na pag instances na namatay yung calf mo, ay yung in instances na namatay yung ina, then dapat parang nakapag-harvest ka na ng milk, ng colostrum, para may makaka-receive pa rin yung colostrum yung orphan na calf natin. So, you can dose the calf orally with either a solution or a bolus to reduce post-calving infection. And then you can repeat when necessary or as indicated. So, mag-ano ka daw ng mga parang antibiotics, mga solution doon sa calf mo para ah, hindi siya susceptible to infection. So, yung gagawin, you insert antibiotic boluses high up in the vagina to prevent uterine infection in the dam. Pwedeng ganun. Then, remove the retained placenta by gentle traction, and when unsuccessful, inject pitocin or oxytocin as indicated. So, seek the assistance of a veterinarian whenever necessary, and then flush genitalia and mild antiseptic. Doon naman sa cow ito, doon sa nanay, then you need to make sure that you have removed yung placenta. So, kailangan if wala kang nakitang placenta within the 24 hours, it is considered as a retained placenta. So, yung gagawin mo is dudukutin mo mismo doon sa vaginal tract nung um, yung nanay na karabaw. Pag naman hindi mo talaga makuha, hindi talaga lumabas yung placenta, then you can inject pitocin or oxytocin. Now, this pitocin or oxytocin, this will trigger yung uterine wall. Parang i-trigger niya yung uterine to contract. So, pag yun yung gagawin, um, may tendency or lalabas ngayon, pwede nang lumabas kasi due to contraction, pwede nang lumabas yung placenta. Then, you could parang flush or you could, ang tawag nito, pwede mong i-applyan ng mga antiseptic, mga antibacterial doon sa genitalia niya para ma-prevent yung infection, ma-prevent yung mga bacterial infection. So pwede mong linisin yung vulva niya, yung genitalial part niya. So for calves up to weaning, so in areas where yung parasitism is common, especially as caries infection, you can deworm yung cara calves as early as 10 to 14 days. Then repeat after 1, 2, and 3 months and at 6-month old. So those with piperazine compound or any equivalent dewormer in its proper dosage. So yung sinasabi daw, if yung area mo is um, talamak or prevalent talaga yung mga parasites, then as early as 10 to 14 day old nung caracal, dapat madedeworm na sila. And then after 10 to 14 days, practice the worming every month. So on the first month, on the 1 month old na yung caracal, on the second month, the third month, and then um, mag-deworm ka ulit on the 6th month. So, sa 6th month na yon, yung gagawin mo is kukuha ka ng mga dewormer like piperazine. Basta yung pag-a-apply mo ng dewormer dapat dapat nasa proper dosage yon. So, just like swine, yung mga cara-calf natin, dapat bigyan rin natin ng iron. So, we can give iron dextran injection 4 to 5 days after birth. And then, we can spray insecticides since calves are easily infected with lice and other external parasites. We can apply this 3 to 4 times at weekly intervals to rid the cara-calves of lice. So, yun yung parang talagang prevalent na parasite na external parasite doon sa mga carabaos natin is yung lice. So, we can spray daw insecticide basta in the right amount para hindi naman maapektaran yung health ng animal, ng caracal natin, para mawala yung mga lice. At saka, pag insecticide kasi hindi lang lice pwede yung other insects that are considered as external parasites. So, mawawala yan. So, you can apply this 3 to 4 times at weekly intervals. to rid of the caracalbs. So, pwedeng 3 times a week, and then 3 times a week ulit next week, or pwedeng 4 times a week this week, and then 4 times ulit next week. So, ganon. So, we can vaccinate also the calves against hemorrhagic septicemia at 5 to 6 months of age, and then give boosters shots wherein you repeat it every 6 months. So you vaccinate against hemorrhagic septicemia 5 to 6 months old, and then every 6 months na doon ka mag-give ng booster shot mo. So for the yearling naman to growing period. So when we say yearling, this is calf, yung animal mo na are 1 year old. So you can separate males from the females at weaning or at 1 year old. So this is to prevent any unsolicited, unnecessary na mga breeding. Then you weigh every month in order to know kung maganda nga ba yung growth rate ng animal. Baka naman may sakit na yan, hindi lang natin nakikita. Kasi yung nakikita mo lang is parang masyadong mabagal yung growth rate. Baka pag ganun, baka may deficiency na siya ng mga minerals or vitamins. So, kailangan natin na i-weigh sila para makita natin yung growth rate. And then, repeat vaccinations when immunity due to previous vaccination has lapsed. So, yung vaccination kasi hindi lang yung one time, big time na i-ano mo na lang. Pag naturukan mo na, um, hindi mo na siya i-vaccinate. So, kailangan pa rin i-vaccinate. So, may every vaccines, may specific na time yan na they are effective. That yung animal are immune. So, yung gagawin, you vaccinate them. Like for example ngayon, you vaccinate them ng hemorrhagic septicemia ngayon. Then, yung immunity ng Carabao, it only lasts for around 6 months. So, after 6 months ulit, doon ka ulit magba-vaccine. So, yun yung gagawin. And then, you control yung ecto and endoparasites every 6 months. Yung ecto, ito yung mga external parasites natin. And then, yung endoparasite natin, ito yung mga internal parasites natin. So, you can control yung ecto at saka endoparasites every 6 months para hindi talaga mag-prevail, para hindi talaga maging outbreak yung mga parasites. So, you need to deworm, delouse, mga ganun, every 6 months. Then, you can treat against liver fluke. Liver fluke kasi yung talamak talaga. So, may specific pa na mga insecticide yun, yung fluxicide na tinatawag, which is given or which is treated to the animal every 3 months. Especially, it is treated every 3 months, especially in areas where there is parasite. Where yung parasite na yung flukes, yung liver fluke is very common. Uh, Pag nakikita mo na it reduces yung infection na talagang may effect yung binibigay mo na fluxicide, then you can repeat the treatment twice a year thereafter. So pwedeng every 6 months. So pwede sa 6 month, and then pwede dun sa 12 month. So basta twice a year mo na bibigyan ng fluxicide doon sa area na common yung liver fluke. Then, you can consult the veterinarian for proper treatment and control of sporadic incidents of specific diseases. Kung talagang hindi mo na talaga makontrol at saka talagang prevalent na makikita mo na parang nagkakahawaan na may outbreak na talaga ng disease, then you consult yung veterinarian para kasi siya yung alam kung paano yung pigilan, paano kontrolin yung disease outbreak na yon. Then, another one, vaccinate against hemorrhagic septicemia ulit. So, that is every 6 months. Then, you test the heifers and bulls for brucellosis and leptospirosis before breeding. Kasi baka magkahawaan eh. Yung breeding, yung act of breeding, pwede magkahawaan yung mahawaan ng brucellosis and leptospirosis um, yung mate. So, kailangan before you perform breeding, kung ito man ay heifer or kung ito man ay bull, uh, dapat you test them with brucellosis and leptospirosis using yung blood test na tinatawag. Then, isasubmit mo doon sa mga laboratories, mga government laboratories, pwede to know specifically kung may brucellosis or leptospirosis siya. Then, for the dry and lactating dams as well as yung mga breeding bulls natin, we could deworm routinely with broad spectrum anthelmintics and then treat against ectoparasites twice a year. So, pwede ganun yung gagawin. Then, inject animals with vitamins A, D, and E twice a year and vaccinate against FMD and hemorrhagic septicemia, foot and mouth disease or hemorrhagic septicemia every 6 months. Pero I guess dito sa Ilocos, wala noon talamak talaga yung foot and mouth disease. Pero due to efforts of the government, I think napuksa na. So, I think wala nang case ng FMD dito or foot and mouth disease dito sa Ilocos Norte. So, pwede pa rin as a preventive measure, pwede ka pa rin vaccinate ng FMD at hemorrhagic septicemia every 6 months. Then for the new addition to the herd or to be used as breeders, yung mga sinasabi ko kanina na mga breeder stock mo, mga new stock mo, you quarantine them for 30 days. So, kailangan 30 days mo na i-quarantine sila. Kasi within that 30 days, most of the time, dito mo makikita if may magpe-prevail ba na symptoms, may makikita ka bang symptoms during that 30 days. So, kung may nakita kang symptoms, then you perform appropriate action. So, pwede i-treat mo kung bacterial disease man yan, then antibiotics. If it is a viral disease, then you treat them accordingly. You vaccinate them after gumaling sila sa mga ganon. So, kung wala ka namang nakitang mga disease or mga symptoms of diseases within that 30 days, then you can safely introduce them to the existing herd. Then, within that 30 days, para malaman mo kung ano nga ba yung para 100% sure ka kung ano nga ba yung disease, kung may disease nga ba yung nabili mong breeder, then you could perform blood tests doon sa sinabi ko kanina na mga government agencies. Then you deworm it again with broad spectrum anthelmintics. Then, like what I've said, paulit-ulit lang, inject vitamins A, D, and E, and then vaccinate against disease prevalence. So, here we have yung mga common diseases of Carabao. So, yung disease incidence and mortality are more common in young and old Carabao. So, doon sa mga hindi masyadong bata at hindi naman masyadong matanda na mga Carabaos natin, hindi masyadong nadadapuan yan ng mga diseases. Doon lang sa mga yearling, pwede. Doon sa mga bagong panganak na mga Carabao at doon sa mga masyado namang matanda na mga Carabao, doon mostly nagpe-prevail yung mga diseases. So, most of the neonatal or calf mortalities are associated with calf scouring na tinatawag or yung diarrhea and are believed to be more bacterial origin and brought about by failure of colostrum intake and postpartum infection. So, sinasabi daw na most of the mortality that doon sa mga batang mga calf, yung mga kapapanganak pa lamang, yung mga young calf talaga, it is often associated with scouring or yung diarrhea. So yun yung nakikita nila na bago mamatay yung calf, nagdadiarrhea pa lang, nagdadiarrhea sila. So they believe na yung diarrhea na yun, it is caused by bacterial or it is caused by bacteria. And this bacteria na nagiging susceptible ngayon yung mga calf natin through scouring because of this bacteria kasi hindi sila nakapag-take ng colostrum. Hindi sila nakapag-suck ng colostrum doon sa nanay. Kaya nagpre-prevail yung scouring kasi late na sila or wala silang chance na nakapag-take ng colostrum. Kasi yung colostrum, this is full of nutrients and antibodies that will help against yung bacterial infection, yung bacterial attack para hindi dadapuan ng bacteria, hindi mag-scouring yung young calf natin. Some diseases manifest similar clinical signs and responses to disease agents. Thus, confirmation of disease must be done in the laboratory. So, yun yung parang mahirap when it comes to disease diagnosis. Since most of the diseases na nakikita natin, pare-pareho yan ng symptoms. Lack of appetite, may mga nagdadiarrhea, may mga hindi nakakatayo. So, hindi mo talaga ma-pinpoint exactly kung anong disease yung nandoon sa animal natin. So, yung the best way to confirm it is through blood testing. So, kukuha ka ng sample, pwede yung saliva, pwede yung blood. So, then, ano mo yan, ipapadala mo doon sa mga laboratories, sa mga government agencies, and doon, mako-confirm mo kung ano nga bang disease talaga yon. So here we have yung mga common na mga viral and arthropod-borne diseases of carabaos in the Philippines. So I will not be discussing all of it. So yung mga parang common lang. So first is yung foot and mouth disease or yung FMD na tinatawag. So yung FMD, anong tawag nito? Pag hindi vaccinated talaga yung animal, talagang magkukos yan ng outbreak. Kasi yung mga age group ng mga affected carabaos, all ages, hindi lang, kahit sabihin mo na matanda na yung carabao mo, kahit hindi na siya bata, wala pa rin siyang resistance to FMD kung hindi siya na-vaccinate. So, may tendency na magiging outbreak talaga itong FMD pag hindi na-vaccinate, hindi na-control. So, yung cause ng FMD is yung virus. So, sa Philippines, there are 7 known serotypes. Pero, 3 lang yung nag-e-exist dito sa Pilipinas. Yung virus A, virus O, and virus C na nagkukos ng foot and mouth disease. So, transmission niya ng foot and mouth disease is through direct contact, direct ingestion ng mga contaminated materials. So, meaning, yung saliva, like for example, yung saliva ng carabao that is infected ng foot and mouth disease, napunta doon sa, like for example, yung mga feed. Now, yung saliva na yun, it is infected by foot and mouth disease virus. Now, pag kinain yun ng isang carabao that is not infected by foot and mouth disease, pag kinain niya yun, pwede maipapasa ngayon yung virus sa kanya. So, meaning, magkakasakit rin yung carabao na yun na kumain ng infected na feed. So, yun. So, pwedeng direct contact rin. So, pwede pag overcrowding, naipasa yung saliva nung infected na carabao doon sa hindi pa infected, then may tendency na magkakaawaan. So, yung control and treatment, most of the time, it is for control and preventive measures lang talaga. Lalong-lalo na if it is a virus, hindi talaga wala masyadong treatment. I guess na yung masasabi mo talaga na ito yung i-administer mo na drug para mawala itong virus na to. So, walang ganun. So, yung ginagawa, prevention and control lang talaga. So, yung prevention mo is through vaccination ng mga FMD viruses. At saka dapat proper hygiene, pag-a-apply ng mga antiseptic para mawala yung virus. So, and then you also have other viruses or diseases of the Carabao. So, another one is yung hemorrhagic septicemia na tinatawag. So, now this hemorrhagic septicemia, like the FMD, it affect all ages. So, yung causative agent niya is yung Pasteurella species, and the transmission is to aerosol route, contact, then contamination. So, aerosol route contact, pwede sa air. So, yung clinical signs, variable, commonly fever and respiratory syndrome pag hemorrhagic septicemia. Now, the hemorrhagic septicemia, pwedeng vaccination, yung gawin mo, and then for control, i-quarantine mo yung may sakit ng hemorrhagic septicemia, and then you can apply broad-spectrum antibiotic during the early stages of the disease. So, yon. Another one is yung leptospirosis or yung bovine lepto na tinatawag. So, just like the hemorrhagic septicemia, kasi delikado rin kasi it affect all ages. So, lahat na ng ages, mapabata man or matanda nung Carabao, it can, the leptospirosis, the disease leptospirosis can affect. So, yung causative agent ng leptospirosis is yung Leptospira species. And then you can transmit this, or the Carabao can transmit this disease via yung ingestion ng urine, pwede, via yung ingestion ng contaminated materials, and yung mga transplacental na mga pagnanganak, yung Carabao that is affected with leptospirosis, pwede yung placenta niya. So, pwede doon magkakawaan. So, yung clinical sign for leptospirosis, you have yung jaundice na tinatawag, bloody urine. So, yun yung mga clinical signs. And just like the hemorrhagic septicemia and the foot and mouth disease, the prevention mo is through vaccination. And then, you eliminate yung mga pwedeng contaminant. So, yun yung gagawin mo. Then, another common disease is yung tetanus. It is all ages nung Carabao. And yung causative agent is yung Clostridium tetani, which is a bacteria. So, itong Clostridium tetani, naninirahan ito doon sa mga soil natin. So, meaning, yung Clostridium tetani, it is present talaga doon sa soil. Kasi soil-borne bacteria ito eh. Present doon sa soil. And then, maaring, it can affect the Carabao through yung mga sugat, through the wounds, through the mga breaks doon sa skin, pwedeng papasok ngayon itong Clostridium tetani. So, most of the time, if may sugat yung animal, like yung sa castration wound, dapat talaga na bibigyan mo ng proper na sanitation, proper na dapat nagbigay ka ng mga wound spray na tinatawag para hindi ma-infect yung mga wound. So, yun. So, yung clinical sign for tetanus is stiff gait. Kasi yung Clostridium tetani, it affect yung parang sa brain natin eh. Doon sa parang nervous system natin. So yung mangyayari, stiff gait na tinatawag, hirap maglakad. And then increase irritability, rigidity of legs. So yun, ina-affect niya yung nervous system, yung mga motor neurons natin, kaya yung mga Carabao hindi makakapaglakad ng maayos, stiff yung paglalakad. And then, like in mga humans, in severe cases of tetanus, yung lockjaw na tinatawag, yung hindi mo na talaga magalaw yung jaw mo. Then, for the control and treatment, we have here yung antitoxin and then proper hygiene para hindi ma-infect yung Carabao. So, yun yung mga common bacterial diseases of Carabao in the Philippines. Meron ring iba, pero ito yung mga common. So, with that, that ends my video presentation on the health and health management program, health and diseases of Carabao. So with that, I hope you will have the time to go over it, and thank you for listening.